Welcome back to the Let's Fix It series about the American healthcare system. I'm Dr. Chris Robertosi, a practicing podiatrist in New Jersey. This podcast will review payments and administrative burdens. There are two payment paths. One is the payment to the insurance carrier for coverage by the patient or the company that pays for part or whole amount of their employees' healthcare coverage. The other is the payment to the provider from the insurance company for medical services that are provided. It always intrigued me how salaries for any job were determined. I remember when I first opened my office, 2 nights a week and on Saturday mornings, Fran typed up all my reports on an IBM Selectric 2 typewriter. One day, when the news came on over the office radio, it was discussing the contract that a sports figure had just signed for millions of dollars per year. The announcer stated at the end that this sports figure could do what other sports figures in his sport couldn't. Fran looked at me and said, "I don't get paid millions of dollars for what I do, and there aren't many people who could type 150 words a minute without a mistake." Fran got me thinking, how do we calculate salaries? How is the minimum wage determined? During the pandemic, when individuals were dying who had COVID, healthcare workers were leaving the field left and right for a good reason. Who would take care of their family if they contracted COVID and died? The increase in salaries did not keep them. Education isn't the driver of salaries either. The CEOs of large corporations, sports figures, as well as actors and actresses' salaries are higher than physicians who went through 4 years of classroom learning beyond college and then anywhere from 3 to 7 more years of clinical learning in residency programs and fellowships. Why is it that professionals who make service calls after hours get a shift differential, but physicians who get called to the emergency room in the middle of the night to save someone's life or limb don't? Why do those who make service calls get a fee for showing up at the site in addition to their fee for time and labor for doing the job, while physicians don't get a fee for showing up for a house call? For many companies, healthcare insurance is part of their benefit package. The Affordable Care Act mandated that full-time employees must be given healthcare insurance. So many companies now hire 2 part-time employees to not have to pay for healthcare insurance. This provides more jobs, but not necessarily with the employee making enough money with the 1 part-time job to pay their bills. It helps cut down on overhead for the company, which helps them keep their costs down. Inflation is also kept down when prices don't continually go up. These are the issues that need to be addressed when looking at how to fund healthcare. How can we do it so it's affordable for individuals and businesses and pay the providers fairly? There are areas to focus on that drain money away from providing care for patients. Fraud on every front must be eliminated. It is present with physicians, healthcare facilities, insurance companies, and patients. The filing of frivolous lawsuits must be addressed. This problem goes back decades. President Obama promised the American Medical Association that if they backed the Affordable Care Act, tort reform, the way to correct malpractice dilemma, would be addressed. However, tort reform was never addressed in the Affordable Care Act. Medical records are in different electronic health records that are not linked together. The role of stocks in healthcare insurance companies must be evaluated. These areas contribute significantly to the high overall cost of the American healthcare system without improving it. In general, insurance premiums are calculated by actuaries. They look at the previous year's expenses, predict what the increase in healthcare services will be, figure an increase for the following year due to inflation, and the increase in the cost of living. This is then divided by the number of policy holders. with different plans to come up with a yearly premium. The American Medical Association has a committee that looks at and sets the relative value units for all their codes. The relative value unit reimbursement rate, which is a dollar amount, is multiplied by the number of units for each individual procedure to get the provider's reimbursement rate. This is not used by every insurance company. Rather, each insurance company calculates its own reimbursement rate. Thus, they set their own fee schedule for physician reimbursement. They vary from insurance company to insurance company and CPT code to CPT code. For the last several years, healthcare premiums have gone up while reimbursement to healthcare providers has gone down. The insurance companies state that they must raise their prices because of inflation and cost of living. Those same issues affect every healthcare provider, be it a physician, hospital, or whatever. So, are the providers doing it? There are several ways they are cutting costs. Staffing is cut back, staff hours are reduced, less time is spent with each patient, benefits are cut back or not paid at all at the same level as they have been. Raises are minimal, if at all. When full-time employees leave, they are replaced by part-time employees, so healthcare coverage and full-time benefits don't have to be paid by the employer. Physicians are working longer hours without an increase in pay. Unfortunately, none of these improve the quality of care. An example will shed light on this. In 1983, when I opened my practice, a new office visit in my geographic area, CPT code -4, $99,203, paid between $20 and $40, depending on the insurance carrier. The minimum wage was $3.35 per hour. The bunionectomy CPT code 28296 paid between $2,000 and $2,500. Now the minimum wage in New Jersey is $15.13. Code 99203 pays between $60 and $128 with a copay or coinsurance if there is one. A bunionectomy reimburses between $400 and $700. Minimum wage went up approximately 4.5 times. Then the reimbursement should go up at least that much to maintain the status quo. There is also inflation and cost of living that affect the healthcare industry. That would mean that the code 99203 should be paying $90 to $180, while the surgical procedure where the physician must follow the patient for 90 days without any additional reimbursement decreased by 65 to 80%. There is no question that providing top quality health care and staying within a budget is difficult for us. To achieve our goals, multiple changes must be made. If we don't change, the system will collapse. It is being pressured from every direction. Today's healthcare providers want a better quality of life than their predecessors. This will undoubtedly help reduce the high burnout and suicide rates in healthcare. As new technology and better medications become available, there are additional costs to the system for these cutting-edge treatments. The use of WebMD and Google to look up information about diseases many times tends to backfire because they talk about the disease entity by itself. Most of the time, there are other factors that come into play with a treatment plan. Despite the physician's best effort to explain why the internet is not the best or that the patient has the wrong diagnosis, the patient is left with the impression that the physician is not listening because he is not agreeing with them. Yet, nothing could be further from the truth. The physician is listening and is trying to get the patient on the road for the quickest recovery. Physician-patient relationships are strained because physicians can't spend the time that they want with the patient due to the many administrative burdens, which bring us to that topic. The caring in healthcare is rapidly fading away. It has become a business which has brought us to be the worst healthcare system in the world. It has also caused the assassination of Brian Thompson, CEO of United Healthcare. The administrative or business side of the healthcare has become a full-time job. authorizations, predeterminations, referrals, letters of medical necessity, disability forms, appeal letters for denied care that take both staff and physician time away from caring for patients. By taking advantage of technology, most of these issues can be overcome. Let's look at authorizations for a procedure or medication. The patient or someone helping the patient should be able to go on the insurance company's website, type in the procedure code and diagnosis using the patient's identification number to log in, and not only see if it is a covered service, but to see what their financial responsibility will be. This is in line with the federal law that talks about transparency in billing. The patient should know what their out-of-pocket costs will be. Providers and hospitals can't tell the patient what their out-of-pocket will be because they don't have the allowed and paid amounts by the insurance company. Those two figures determine what the patient will pay the provider. It is common that staff are on the phone for approximately an hour to get one authorization for one procedure for one patient. This is a waste of time and money for the provider as well as the insurance company, and it further deteriorates the quality of health care by taking away from the patient. Authorizations do not mean the insurance company is paying for the service. However, if the provider does not get an authorization, then the service is not covered. Consequently, the provider must have staff explain this to every patient and make them aware that they may be responsible for the bill. In some cases, the patient is asked to sign an advanced beneficiary notice, letting them know that they should be prepared to pay the bill in full. Once again, a significant waste of time and resources. There are multiple disability forms. Yes, there is an overlap of questions from one form to another. By having one form that is formatted in the electronic medical record, the time to complete the form can be shortened as the patient information can be pulled through. The rest of the information can be typed or dictated, so there are no issues with being able to read what was written on the form. The provider will know what is required before sitting down to complete the form. The explanation of benefits and electronic remittance advice should also be standardized across the industry. Not only are some of the forms hard to understand for the physician staff, but when the insurance company is called, it takes several phone transfers before someone from the insurance company can explain it. These are just some of the more common issues. When the meetings start, a more in-depth evaluation will be performed. It is in everyone's best interest to be honest about the struggles that they are having so a solution can be reached that helps provide better patient care at a lower price. If you want better healthcare system and think that what I'm proposing will get our country there, then contact the organizations in the comments section and ask that they send a representative to the Zoom meetings to start on February 5th, 2025 at 4 p.m. Eastern Standard Time. They have all been sent an invitation for the proposed collaboration on healthcare. You can see all the organizations and their phone numbers on the website www.betterhealthcarereform.com. It is appropriate, if no one answers the phone, to leave a voicemail. A simple statement such as, "Please participate in the Let's Fix It Healthcare Reform Zoom meeting starting on February 5th, 2025 at 4 p.m. Eastern Standard Time." Feel free to give your name and any other pertinent information you are comfortable sharing. The listed associations received a letter in December with all the details. Those who attend will write the healthcare proposition that will be sent to Congress to make the appropriate changes. Whether it is a law or alterations in the delivery of healthcare, a summary of each meeting will be posted on the website within a few days so you can keep up with the progress and provide feedback. Likewise, the recommended changes that will be sent to Congress for approval will be posted. The Affordable Care Act took 26 months from the time President Obama took office until it was passed by Congress on March 23, 2010. It was not implemented until January 1st, 2014, 45 months later. Our goal was to write the proposal, pass Congress, and be implemented in less than 6 years. Thank you for taking time out of your day to listen to this podcast. Please share this with your family and friends, and let's work toward a better healthcare system for all American citizens. Please contact the organizations and let them know that you would appreciate their participation at the Let's Fix It meetings so we can achieve a better quality of healthcare for all Americans and reverse our rank in healthcare in the world.